We know that when you do it properly, you bring down those cases. We've done it. We've done it in New York. New York got hit worse than any place in the world. And they did it correctly by doing the things that you're talking about.
Not everybody's so quick to jump on board and applaud New York's coronavirus response. Among the skeptics, we're going to be talking with Kentucky Senator Rand Paul in a few moments. He tweeted, paging Dr. Fauci, according to Johns Hopkins University, New York's per capita death rate is more than 2 times greater than Italy, Spain, and Britain, and more than 8 times worse than Florida, and 10 times worse than Texas. For you to say New York got it done correctly disregards the facts and calls your judgment into question. Senator Paul joins us now to explain more about why he is saying this. Senator Paul, thank you for joining us, sir. I take it you're not crazy about the job Dr. Fauci has been doing.
Well, I'm perplexed. You know, the left says, well, we're going to look at the science and the evidence. Well, the evidence I see coming from the government's websites or from Johns Hopkins websites says that it was a disaster in New York. You know, the death rate in New York was monumental. When you look at the death rate per capita, it's, like we said, 8 times worse than Florida. But you don't get that. You watch CNN or MSNBC and they're saying how terrible Florida's doing, when in reality, Florida's doing 8 times better than New York. And then Dr. Fauci says, well, you look at New York and that's a model of success. Well, to me, I look at New York and say that that's a model of disaster. 30,000 people died, including all the people who died in the nursing home because Governor Cuomo made the really terrible decision of taking people who were positive for the virus and putting them back in the nursing home, which became breeding grounds for coronavirus. So no, I see nothing in New York to emulate. Now, they did do a lockdown in New York, and they still had the worst death rate of anyone in the country. So I think it's one of the arguments to be made here is that perhaps the death rate is happening independent even of what we do as far as social distancing or any of the things we try to do to mitigate this, that the virus has a mind of its own and that ultimately it runs its course. And one of the things they're missing now, and I wish Dr. Fauci would look into or discuss, is that New York's death rate now has plummeted and their new cases have plummeted. And some are offering the theory that they may have achieved a form of immunity at this point and that most of the rest of the South is going to have to achieve that immunity until we have a vaccine, unfortunately, the hard way.
Well, is there something we should learn then from New York, either good or bad, that we should now apply to Texas and Florida and other states?
I think the main thing we learned is not to send people who are positive for the disease back into nursing homes. That's the #1 lesson. So I think Florida and Texas and the other states that are seeing increased cases are going to do better with the nursing home population. I think we've also learned from the medical point of view that rushing people onto the ventilator may not be the way to go. We're also learning that steroids have a role in this as far as trying to lessen what they're calling this cytokine storm, where your immune system becomes overreactive at some point. There have been some people talking about inhaled steroids, but they've definitely been using injected steroids. So medically, we're learning some things. But the other big news out of the South is there is an increase in cases. Some of it's testing, but there's a real increase in cases of people who have this disease. But the age is skewing younger, and the amount of people dying compared to the amount of people infected is actually going to be much lower than New York, because we're going to have millions of people, unfortunately, probably end up getting this in the South, but it looks like the death rate for those who actually get infected with the disease is going to be much smaller than it was in New York.
Then as a doctor, when you observe that, how does that affect the decisions you would make as far as how to treat this? Because there are some hospitals that are showing their ICU beds are getting full. What kinds of things should we do in response?
I think the most important thing to learn from all this is one size doesn't fit all. So New York City is not Bowling Green, Kentucky. They're much different in size and scope, in population density, in international travel, so they should be treated differently. But not only are cities and states different in population density, we also find that individuals are responding to this much differently depending on age. So from 0 to 18, the death rate is about 1 in a million, much less than the seasonal flu. From from age 18 to 45, it's about 10 deaths per 100,000, also less than the seasonal flu. But when you get above age 45, it's more serious than the seasonal flu and has a higher death rate. So I think that the risks and the precautions should be based on each individual's assessment of their own risks. And in a free country, individuals make those decisions. The government doesn't make those decisions for you. We put out information. We may try to persuade people, but in a free country, we let individuals make their own decisions based on their own health and the risks to their health.
Yeah, they may not be Bowling Green because they don't have a Corvette museum, and that's a good one there. So let me ask you this. Should Dr. Fauci be included in the new pressers that the president plans to start again today?
I think that when we look at who the experts are, there are experts who have spent their whole life in government, like Dr. Fauci. There are also experts like Dr. Scott Atlas from Stanford, who spent life in a university, but also in private practice, that have a different perspective. So I think we need to hear a variety of perspectives. We need to hear from the American Academy of Pediatrics, has said we should get back to school. There are a variety of opinions, and no one person has a monopoly on all the knowledge, myself included. So we need to hear a variety of these opinions, a variety of interpretations of the facts, but then each individual should make that decision. So going back to school, I think schools should be open, and I think the government decision should be to open schools, but whether you send your child to school, I think is your choice and your individual choice, and it should be based on your assessment of the risks, who lives in your personal home, that kind of thing. But the good news is that when we do contact tracing studies, we find that kids rarely get this, rarely die, and are rare or poor transmitters of this disease to other people. So there's a lot of good news out there that the government hasn't been very good at letting us all know. And I think it's important for everybody to get that information so you can make your own decisions.
Senator Rand Paul, thank you for joining us, sir.
You just watched Newsmax TV, America's fastest growing news channel, now in 65 million homes. Get Newsmax TV on all the major cable systems or go to newsmaxtv.com and click on the Find Newsmax tab to locate us. Remember, Newsmax TV, we're real news for real people.